Assalamualaikum dear doctor. In this video I am discussing a video station, and this video station is also important for clinical exam. This is one of the favorite topics. Okay. So look the image we are seeing, that is caveolate macules. Caveolate macules, how? That is a hyperpigmented macules with well-defined borders. If more than 6 present, consider neurofibromatosis associated with the following condition, that is ataxia telangiectasia, tuberous sclerosis, McCune-Albright syndrome and Russell-Silver syndrome. So remember, when we see a patient that is caveolate macules, we concentrate the number. If it is more than 6, then it is considered neurofibromatosis. And the condition also we learn. Look the image again. We are seeing in this patient caveolate spot. Below this image we are seeing some neurofibroma, and on the axilla also we are seeing some axillary flickering. Now, how can we describe this? Describe what you see. I can see there are multiple more than 6 brown macules that are irregularly shaped and evenly pigmented, which consistent with the caveolate spots. In different sizes, greatest is more than 3 cm diameter in this child, how appeared in prepubertal stage. There is axillary flickering and multiple neurofibromas and axillary flickering. Now, what are the important question you would like to ask in the history? I would like to ask in the history, family history of the first degree relative with neurofibromatosis. As we know that neurofibromatosis is an autosomal dominant condition. So we ask family history of first degree relative. Number 2, history of visual impairment, headache, vomiting, limb weakness and developmental history. So visual impairment history we'll ask because we know that leash nodule that present on neurofibromatosis. Again repeating, what are the history we'll ask in neurofibromatosis patient, that is family history of first degree relative with neurofibromatosis, history of visual impairment, headache, vomiting, limb weakness and developmental history. Now third question is that what are the other important examination finding you want to look for? So what examination we search in neurofibromatosis patient? So I want to check for growth parameter as expected to be short for age and sex. Cardiac examination we do checking blood pressures because pheochromocytoma, Wilms tumor, renal artery stenosis, neurofibroma releasing catecholamines. Abdominal examination for palpable masses and back examination for scoliosis and tibial bowing. I am again repeating the examination I will do in neurofibromatosis patient. These are I want to check for growth parameter as expected to be short for age and sex. I will do the cardiac exam. I will checking the blood pressure because pheochromocytoma, Wilms tumor, renal artery stenosis, neurofibroma releasing catecholamines. Abdominal examination for palpable masses and back exam for scoliosis and tibial bowing. What are the differential diagnosis? So remember the caveolate spots differential diagnosis we find in neurofibromatosis type 1, tuberous sclerosis, McCune-Albright syndrome, ataxia telangiectasia, Russell-Silver syndrome and Fanconi anemia. Again repeating the differential diagnosis of caveolate spots, that is neurofibromatosis type 1, tuberous sclerosis, McCune-Albright syndrome, ataxia telangiectasia, Russell-Silver syndrome and Fanconi anemia. What investigation you want to request in this patient? Suppose it is a neurofibromatosis patient, investigation you would like to do genetic testing, brain MRI looking for astrocytoma, meningioma and ependymoma. So the investigation we are doing genetic testing and brain MRI looking for the astrocytoma, meningioma and ependymoma. What is your most likely diagnosis here? Most probable diagnosis here neurofibromatosis type 1. So assuming this is a patient of neurofibromatosis type 1, what is your management? So the management need to involve the multidisciplinary team including pediatrician. Pediatrician need the assessment at least yearly checking neurofibromas for signs of malignant change, monitoring growth, looking for scoliosis and measuring blood pressure, pediatric surgeon for managing scoliosis, plastic surgeon for correction of facial deformities, child psychiatry or educational psychologist, geneticist for counseling as the condition is autosomal dominant, ophthalmologist looking for leash nodules. I am again repeating the management portions. The management need to be involved the multidisciplinary team including pediatrician need assessment at least yearly checking neurofibromas for signs of malignant change, monitoring growth, looking for scoliosis and measuring blood pressure, pediatric surgeon for managing scoliosis, plastic surgeon for correction of facial deformities, child psychiatry or educational psychologist, geneticist for counseling as the condition is autosomal dominant and ophthalmologist looking for leash nodules. Management purpose also are you involved by endocrinologist if patient has endocrine tumor, speech and language therapist and radiologist to help guide neuroimaging. Again repeating, endocrinologist if patient has endocrine tumor, speech and language therapist and radiologist to help guide neuroimaging. So this is all about neurofibromatosis video station. It is very important for clinical exam and common topics. Please do subscribe and share. MRCPCH with Dr. Emma Choudhury. Thank you.